So when you were first told that you had cancer, what was the reaction of your oncologist when you wanted to be able to preserve your fertility?
Well, the oncologist at first was very hesitant. I think the diagnosis was already 3 weeks into the time I saw him, and he wanted to push me to get started on my chemo. But, I told him that I didn't want to do that, that I wanted to have some time for fertility, and, I really had to push him. He really wanted me to get started on chemo. He thought that it would, delay things, and I said absolutely not. 1 more week of definitely getting this done would not, be any problem.
So, and you're a physician, you're board certified in internal medicine and pediatrics, so you really understand this, but what about the patient that doesn't have this understanding? Do you think she'll get referred to have her fertility preserved before her cancer treatment?
I hope so. I think, I was lucky enough to find a good fertility specialist who knew a lot of the options that were there. But I think, for me, I'm definitely, if I learn anything from this, at least going through MD Anderson, I think I am going to try to push for them to be more proactive, for them to do this for their patients, especially the young patients, because, to me, my goals are, yes, I have a career, but I'm also a woman and I want to be a mom. Unfortunately, I had other things to deal with, but this is a great option for me to have in the future.
And, MD Anderson is, I'm sure, the best cancer hospital in the entire world. I don't think anybody would question that. And even there, like it is all around the world, there seems to be a resistance to worrying about preserving your fertility.
Yeah, I think, if anything, I got more persistence through the surgeon who was seeing me, and also through the genetics department. They wanted me to consider it, but from the oncology point, he really didn't think that it was something of priority. So, and I don't know why that is. I don't know if through genetics, because they deal more with family issues and all that, and the surgeon as well, I guess because it is a surgical procedure, they know more about it. But on the medical side, he really was very hesitant, and he, it's funny because he told me, I thought you had already made a decision not to do this, kind of putting it on me that I didn't want to do fertility, but at the end, I pushed for it because this is just an option that I wanted to have.
And did this in any way delay or compromise your cancer treatment?
No, right now I'm extremely surprised at how well the surgery went, and how I don't have any pain, and very minimal. There is some pain with walking, but very minimal. I'm able to get up out of bed, walk to the bathroom on my own without assistance. I have a beautiful incision, and I don't think it's going to delay anything at all.
Well, that's fantastic. Well, you're helping us, but we'll get this message across in general, because oncologists around the world just don't seem to get it and don't seem to understand how important fertility preservation is to the woman.
I agree. If I could do anything on my part, is to give testimony of what I went through, and definitely hope that they change their mind and change the way they practice.
Great.
Yes, definitely.
Well, you're wonderful, and so you'll get through this breast cancer treatment, and then you'll be back at your pediatrics and
so.
your internal medicine practice.
Hearing the cry of the pediatrician, which is the song of the pediatrician, which is all those babies crying, which I definitely, I would want to get back to that.
And then you'll be able to have your own baby.
That's right. Hopefully, yes. One day, if I do, it'll be a miracle, and I'll be extremely happy to be a mom, definitely.
Fantastic. Well, it's great knowing you. We'll be keeping in close touch.
Yes, thank you so much.